I work at the Pew Research Center, and one of the ways that I describe our work is that we hold up a mirror to the world. And most of my work is focused on the US. And so we do old-fashioned telephone survey work as well as field work in what I look at is patient communities. And by that, we're able to hold up that mirror so that people can see themselves, maybe for the first time, very clearly. And so then we can make reality-based decisions about what we should do going forward. The other way that our survey data serves the public, hopefully, is as a window. Maybe you don't use a lot of social media. Maybe you're curious about it. Maybe you're not sure how people, let's say, living with chronic disease use technology or social media. We have data that can provide a window into those populations. I'm actually doing analysis right now of a report that's going to come out in about 3 weeks, but I wanted to give a sneak preview of some of it today because I think it really helps to frame the issues that we're talking about. So some of this is public, some of this is not. If I mention chronic disease, that's the stuff that's a sneak preview. We know the data that nearly half of American adults are living with chronic disease, and many more are on the verge of being diagnosed. And so we have this, imagine this huge circle with many people in it who are living with chronic conditions or who are faced with the possibility of being diagnosed. But then think of some other circles. 91% of American adults have a cell phone. Even 78% of US adults living with a chronic condition own a cell phone. 63% of adult cell owners now use their phones to go online. That data was just released today. 8 in 10 US adults have access to the internet. We're still seeing an effect that we call the diagnosis difference, that people living with chronic conditions are less likely to have internet access. And we've isolated all the other demographics to be sure that it's really an effect of just chronic disease. So they still lag behind. And yet once they're online, they're just as likely to look for health information. 7 in 10 American internet users use social networking sites. And the data that we collected this year, which I think is especially pertinent to what we're talking about, there have been many clinical studies showing that tracking can help people manage their weight. It can help them manage pain, diabetes, high blood pressure. And yet there'd never been a national study looking at how many American adults track some aspect of their health. And so we put a survey into the field and found that 7 out of 10 American adults track some aspect of health, whether for themselves or they're a caregiver and they're tracking health on behalf of someone else. Now that sounds like a huge number, but the trick is we asked broad questions to capture the full population and then drill down to find out that half of American adults only keep track in their heads. And by the way, that includes me. And so maybe that's not as good as we would really hope it to be. And so it turned out to be about half of self-trackers use these informal means and half use more formal means. They use pen and paper, they have an app, they have a glucometer, they have some sort of mobile device. And what we find is that people who keep formal notes are more likely to see an impact on their health. Makes sense, right? So what if you can imagine this big group of people who are living with chronic disease or who are facing the possibility of it or caring for someone with chronic disease, and we have this big circle of people who have internet access and or a cell phone. They're using social networking sites. They're tracking, kind of. But what if we could expand that small circle of people who are using a formal means of tracking and expand it? What if the word could get out that this was something that more people are doing? What if we could use the media for people to really understand what the impact on their health could be of healthy behaviors? So the Pew Research Center has lots of data to share about what the market is and what the possibilities are, whether it's online or offline, because we still see that TV is king in our other studies. But we invite you to make reality-based decisions about the media market and clearly John and his team are on the right track, not only including the mainstream broadcast media, but thinking about social media as well.
Thank you, Susannah.